Good Morning Washington's Women's Health Month Spotlight is sponsored by Fairfax Radiology Centers.
Well, every 36 seconds, an American dies from cardiovascular disease, and it continues to be the leading cause of death in the U.S. And as part of our spring screening series, today we are talking about the importance of women's heart health. So I'm joined now by Dr. Melaney Atkins with Fairfax Radiology Centers. And Dr. Atkins, so good to see you. And this is, such an important conversation to have. I'm curious, is cardiovascular disease in women kind of as prevalent as breast cancer?
That's a great question. So 1 in 8 women throughout their lifetime will develop breast cancer. And certainly that's the most common thing we talk about when we're talking about women's health. It's one of the most common topics, but cardiovascular disease is often forgotten. And 1 in 16 women over the age of 20 have a cardiovascular disease.
Over 20?
Over 20, 1 in 16 women have a cardiovascular disease. So it's very common, and it continues to be the leading cause of death in women. It's still to this day. So it's really important that we learn about cardiovascular diseases, and as women, we're very up to date on how we can screen for cardiovascular diseases, diagnostic tools for them as well.
So tell us a little bit about some of the differences between cardiovascular disease in men and women.
So there's a whole host of cardiovascular diseases. Most commonly, we think about heart attacks and coronary disease, but there's also problems that happen with valves, arrhythmias, and things like that. And there's very many differences between men and women. A lot of the presentations are different, although the disease processes are quite similar. The presentation for women can be very different. For instance, in a heart attack in a man, you think of crushing chest pain going down the left arm, and that's not so much of a common presentation in women. And the risk factors are the same for men and women, and we want to have a healthy diet and exercise and all of those things, but we need to be very aware of cardiovascular diseases in women, in addition to all of the other things. And interestingly enough, women with breast cancer actually have an increased risk of developing cardiovascular diseases.
Okay, so I think a lot of our viewers, myself included, now it's like, okay, cardiovascular disease. When should we get screened? How do we get screened, and how does a radiologist play into that?
So my role as a radiologist, as a cardiovascular imager, we're involved in the entire process of cardiovascular imaging. So starting from screening, we do certain screening testing called, one of the examples is calcium scoring. So it's a low radiation dose, very quick CT scan where you can come in. It takes a matter of seconds for the entire exam. And then we look for little areas of coronary calcium. We send that information back to your doctor, and they can come up with a treatment plan to get you on preventive measures to avoid any further progression of coronary disease. And then we have diagnostic tools like coronary CTA, where we look for blockages. We have cardiac CT, where we look for structural issues related to the heart. And then we do cardiac MRI as well to try to find any sort of structural problems going on with the heart, areas that could cause an arrhythmia or an arrhythmic substrate that could cause a problem like that. And then we help as well for procedural planning. So anytime you have a heart surgery, whether it be through a catheter or a major surgery like that, we do the imaging prior to that so that your doctor can see all of the anatomy of the heart and any sorts of problems going on with the heart.
Well, I think that you've really given us a lot to think about, as far as women and empowering us with our health, and especially getting these screenings. So for people that want to reach out to you guys at Fairfax Radiology, how do they go about doing that?
So our website is fairfaxradiology.com. So please visit for much more information about cardiovascular diseases and cardiovascular imaging.
Wonderful. Thank you, Dr. Atkins, so much. We appreciate it. We'll have more of Good Morning Washington after this.